So I think if you look at both the state and federal level impacts, there are maybe 3 or 4 layers that that are important. One are the PrEP Act expansions that the federal government have enacted in place over the last few months. The second is the impact on utilization, particularly pharmacy utilization and in-office, physician in-office utilization impacts during the COVID period, where it peaked off perhaps a few months ago and has bounced back to some extent in some places over the last few months and weeks. A third area I think that there has been an impact on has been the new look at telehealth from a policy, from a provider, from a reimbursement perspective, and perhaps having some impact on pharmacy services down the line. And lastly, I guess one thing that it is a little bit of an inverse to your question, and is the an area that hasn't changed really that much is pharmacy reimbursement. That's something that we've seen being done in pretty much the same ways as before the pandemic hit. One thing that we saw as being a very bold and very dynamic move forward is the PrEP Act declarations that pharmacists are able to provide certain types of vaccinations to certain types of groups that previously wasn't allowed in a lot of states. So that's definitely something that is temporary. Whether it's permanent or not, we will ways that H1N1 has impacted scope of practice in the past, and perhaps ways that COVID could do the same to pharmacies. Another aspect here is state dynamics. The PrEP Act declarations are on the federal level. State level responses have been generally positive, but given that scope of practice lies squarely within the states, they haven't quite been moving in step with either each other or with the federal government, leading to issues between the federal and state government in the future. So that's definitely something to look out for. And like I mentioned before, I think reimbursement still remains a challenge to pharmacists during the pandemic and even perhaps after the pandemic, unless some significant policy changes are enacted. What we've seen is that in-person care may not necessarily be the only way to receive care. This applies for telework, not telework, telehealth rather, but also for things like in-office. We think that because of the pandemic, there might be more of a shift, putting more emphasis on self-administration rather than in-office home infusion. And even if an infusion needs to take place, perhaps moving forward, there might be more emphasis on home infusion and rather than in-office infusions. And I can see managed care pharmacy shifting and really focusing on areas that they previously were not thinking about as a result. The concluding thought is that, during our talk, we're really going to be talking through the implications of COVID-19 directly to the pharmacy world, but also writ large to other parts of healthcare. And I think it's important to keep in mind the question of whether these temporary changes will translate well or easily to permanent changes, and what that post-COVID world may look like. We'll go into some potential examples, but I think this is an important discussion to have and the right time to have it.